Revolutionary talk for revolutionary times. Promoting peace, liberty, and prosperity around the clock. LibertyTalk.fm.
Welcome to Living in the Solution with Dr. Elena George. Today I have one of my favorite people on. I feel so happy when she comes on because it's like talking to somebody who gets it, an old friend, but someone who can speak knowledge, with knowledge about how this healthcare system is. I don't know if it's working. It's not working for doctors and patients, let's be honest, but it's working for somebody because it keeps doubling down on the worst aspects of our healthcare system. Today we're going to speak with Dr. Marilyn Singleton, and she's a gem. One, because she's an awesome person, but two, because she has a facility with not only being a medical doctor, but also understanding the law, as she has a JD degree. And we're going to talk about insurance today, health insurance. It gets a pass, I think too much so, because to me, it's one of the drivers of why our system is so bad. And nobody seems to be able to rein them in. I've gone to Congress, I've gone to the Department of Labor, I've gone to my insurance commissioner, I've gone everywhere, and I've yet to be satisfied as a physician and an advocate for my patient on how, they're paying for a service they're not getting, and we're actually on the hook for things, and I'm just done with it. So I wanted Dr. Singleton to come on today and give us her take on why our healthcare system is the way it is, how the insurance companies got to be so huge, and what we as doctors and patients can do about it. So Marilyn, thank you so much for joining me today. I feel like I just need to have an old-fashioned powwow with someone who gets it so I can get it out.
Well, thank you for having me on the show and that great introduction. I should just quit while I'm ahead. My goodness. Let's just talk about paying for health stuff, paying for things in the community. If you go all the way back to our early settlers, they took care of each other. And of course, we didn't have MRI machines and fancy hospitals and all these other things to pay for, but they did have doctors and they did have nurse midwives and things like that needed paying, but the community paid for it. And so that's kind of how people did early insurance. But then when the Industrial Revolution came in, people started getting injured. So there were all these on-the-job injuries. So they definitely needed doctors. And the companies just said, okay, we'll take a little bit of money out of everybody's paycheck, and that would pay for the doctor. And they usually had a doctor on site. You can imagine in the old days that people were getting injured all the time. So that was sort of the early insurance, certainly made sense. And it's kind of the embryonic present day workers' comp. But then it was like everybody else needed to have insurance. So during the Depression, the Great Depression, 1929, some teachers at Baylor in Dallas had a group plan. What they did was contract with a nearby hospital, and for a monthly fee, they would get all the care they needed. Now, at the time, it was 50 cents a month. Oh, would that it was that now.
Yeah.
So everybody was happy because the people knew that they'd already paid into something, and the hospital knew that they'd get paid. And so a lot of other hospitals thought, this is a good idea. So more and more did it. And thus we had the modern day insurance system. The thing that's interesting, there were lots of companies that offered insurance once we had the so-called indemnity insurance, where somebody would do a service, then they'd submit a bill, and then they'd get paid whatever the bill was for the service. There were about 900 insurance products out there. Now there's just a handful, and all the monopolies and everything make it so there's not that many companies out there offering. Therefore, the prices continue to be high. But the real problem came in World War II. There is a wage price freeze. So in order to get new employees, the employers offered health insurance. And that was the benefit instead of higher pay. And that's when Blue Cross came into the picture in a really big way. So this covered emergencies and hospitalizations. And it's kind of interesting because that's what most people thought of, that's what insurance should be for, emergencies and these huge bills that there's no way you could pay. Because certainly by the 40s, we had lots of hospital things. We had x-rays and EKGs and all these things that suddenly started costing money. But people still paid the doctor out of their own pocket. But then as time went on, it just ballooned. And so insurance was paying for everything, even day-to-day stuff. So you can imagine that if your car insurance paid for your gas, paid for your tune-up, how expensive the car insurance would be. And that's exactly how health insurance is now. It completely moved away from the original concept of protecting against a big risk. I mean, the whole idea of insurance, when it started back with Lloyd's, and the reason it was Lloyd's, there was a bar where people sat around, and when ships started crossing the ocean, they'd guess, is that ship going to sink or is it not going to sink, with all the goods that were on board. So it kind of started off as betting, but then somebody got the idea that they just insure the ships, and people would get these chits and they'd say, okay, give me 200 on that ship, or, however amount of money they wanted to give. And that's how they had the pool of money. So you get a pool of money from a lot of people to pay for a big risk. But if you're paying for everything, what if they had to pay for every crossing of the ship across the ocean? There wouldn't be any money in the pot left. So that's what happened to health insurance. Hopefully that wasn't too blah, blah, blah.
No, not blah, blah, blah at all. But two things strike me about what you said. Initially, it seems like it was a one-to-one, right? The people got together and paid the doctor. There was no middleman. There didn't seem to be anything in between that could siphon money away and didn't have, how can I put it, a peculiar interest in not paying out because they wanted to make money. It's for profit. People don't really consider the insurance companies as profit-making entities. They have this earthy, crunchy, sweet little commercials about how they love the patients, but they actually love money more. And there's nothing that I can see that reins that in. It's a conflict of interest, isn't it?
In a sense, it's interesting because in the law, there is a cause of action against insurance companies, and there's something called first party bad faith and third party bad faith when you think a claim hasn't been paid in bad faith. Now, most states these days have these appeals processes and all this kind of stuff if your insurance doesn't pay for something. But as we all know, if you go through this whole system, and there's always some sad story about some poor creature who has cancer and the insurance doesn't pay. And even though ultimately they appeal, like 2 years later, they decide to pay. And in the meantime, the family's gone bankrupt, even though they've paid their premiums, but they're not going to let their family member die of cancer just because the insurance company didn't pay. So there's certainly an effort not to pay. I took a course in law school called insurance law. And interestingly, not very many students were in the class. It was only about 30, maybe 35 people. And the teacher said he's always surprised that so few people signed up for it because insurance companies rule the world. And we really need to know how insurance worked. And he said that if you go to an insurance convention that, they'll begin with a joke. And I think the company he used is Farmers Pay to Claim. And that was the big insurance joke. So they don't want to pay claims. They want to keep their money. And there's people sitting behind the curtain who calculate it all up and look at the risk and decide how much money they need. And they have something called reserves. And excuse me, that there's something interesting about reserves, that insurance companies have to have those to show they're solvent, and it's the amount of money they have on hand. And sometimes we'd get paid in bulk by certain insurance companies because they wanted their reserves to be high at the end of their fiscal year. Then the new fiscal year, then they dump the money and pay out. So here they were even manipulating the timing of payments.